Hi there. So this week we're working on OT insights, things that your occupational therapist or other professionals might have talked to you about but are still a little bit confusing. So today what we're going to talk about is joint input. So that's the traction or extension and compression of joints. What that might look like that your child is looking for joint input is if they are having a hard time relaxing, like if they're sitting there fidgeting, or I used it a lot with preschoolers in circle time. You can use this with school age children too. If they're kind of having a wiggly time and unable to settle, it's very calming and relaxing. So here is something that I do with children that I feel you would be able to do as well with your child. And it's very important to note that when your child's body is looking for this, you're not chasing them down to do this. They're kind of coming to you, or they're seated so you can gently take their hand, because we're going to work with the hand. You can gently take their hand and work with them. And yes, I burned myself cooking the other week. That's what that is right now. So I would, if a child is sitting in my lap, I would reach my hands around and give them gentle pats on their back, remaining in contact with their back, just going down their back. That's not joint, but that's compression. Well, what I would do for joint compression with their hand is I would take their hand and I start in the middle and I rub my thumb in a circular motion. So I really calmly and quietly, it's kind of how you talk to someone too, right? So if someone's elevated and you whisper to them and it sounds a little bit like a secret, your child has more of a chance of listening to you than if you yell really loud, because then it excites them even more. It levels them up. So you want to be their co-regulator. You want to bring them back down if they're up here. So that's what this does too. That's not joint input, but this is helpful information. So I would take a child's hand and just slowly count 1, 2, 3, 4, 5. And so what I'm doing is I'm pressing and massaging, but it's not hard that it would hurt. It's pressure so that a child can feel it. And then when I'm finished with that, I would and my hand is gently back here. I would rhythmically and give it a little pull, not a lot. And especially children who have very hyper flexible joints, you don't want to do this very hard at all. It's just a gentle pull. And then I would do the next one, a gentle pull. So that would be 3, 4, 5, and then you would move on to the other hand. So let me just do this with you like I would a child. And again, it's gentle. So it would be 1, 2, 3, 4, 5, 1, 2, 3, 4, 5, really gently and rhythmically. So you can try it on yourself, and if you have a partner or another grown-up or another child to try it on first, I would definitely suggest that. And I'm going to do it to myself now as we're talking. It is relaxing. There are many other things to do for joint compression and extension that I would want an occupational therapist to recommend to your child and train you and show you directly, which is why we're just doing hands. But definitely reach out to your occupational therapist or professional to learn more about this. And you're always welcome to message me as well. Okay, that is joint compression. I hope you have a great day, and I'm being curious to see how many times you do this to yourself through the day too. All right, take care. Bye-bye.